Hi, my name is Dr. Yong Meng an eye doctor. Diabetes can affect the eye in various ways. One of the common mechanisms is by impairing the blood vessel in the retina, which is one of the important structures in the eye that capture images like our camera. So when the diabetes happens in the eye, it starts with the tiny vessel that start with the bleeding and also the leakage, and also some focal damages in the retina. In this silent stage, even with the progressions, patient may not notice any vision impairments in the early stage. The common problem of the diabetes, one of it is a diabetic retinopathy. It's a term that we use to describe the problem with the retina blood vessels that impair the blood vessels and also the blood perfusion to the retina. The diabetic patients also can have a prone to infections because their immune system is low. So eye infections can affect various parts of the eye. Whoever patient that presented with the pain and so redness and also impaired visions should get the attention immediately. Another condition is the reduce the blood flow to the eye suddenly because the blockage to the blood vessel is almost equivalent to the eye strokes. This problem can lead to the sudden onset of the loss of visions or loss of part of the visions. As mentioned, diabetic retinopathy from the beginning will be a silent disease. So the patient can have no symptom at all. But when the disease progresses, the patient usually start to notice some vision problems. For example, distorted visions, blurring of visions, cloudy visions, or they may notice some bright spot and also the black spots either in the middle of the eye or floating inside the visual field. These early symptoms will warrant some very early examinations of the patients so that to avoid further complications. For patients who can have infections, they also need to watch out for pain, redness, and also blurring of vision occur at the same time, which should seek immediate examinations by the healthcare doctor. For patients living with diabetes, we advise them to have eye examinations at least once in a year. It starts as soon as possible when you're diagnosed with the diabetes, especially for those who have the type 2 diabetes or those who have diabetes detected during the pregnancy. So it depends on the finding during the examinations. The frequency of the next examinations will depends. Either it will be shortened in case you have a mild disease, or the active medical treatment will be given in case you are already presented with a severe disease. So during the eye examinations, the patient will be expected to have a dilated fundus examinations or fundus photography. Both of these procedures is a painless and also the very simple procedures. This allows us to have a comprehensive examination on your retina by dilating your pupil so that the eye doctor can have a very thorough check on your eye to make sure that your eye is in a good state. Diabetes eye disease is a preventable disease. The good control of the diabetes is the key. Take your medication regularly, follow up with your eye doctor regularly, and also have a balanced, healthy diet together with the consistent exercise. All this will help with your control of the diabetes and also indirectly and also directly prevent the onset of the diabetic eye disease. Don't hesitate to reach out to your healthcare teams. For example, those who take care of diabetes, for example, your physicians and also the GP doctors, your eye doctors, dietitians, and also diabetic educator in case you need more information on how to control your diabetes.